A meeting of minds and funds promised, all to enable African countries dependent on vaccines made abroad to access and produce their own. Among those gathered here, health organisations and pharmaceutical firms. An urgent effort, say leaders, to make the continent more self-sufficient in the face of the next pandemic.
Africa manufactures only 2% of the vaccines that it uses. And the aim that we have set for ourselves is that by 2040, 60% of vaccines are to be manufactured on the continent.
More than $1 billion has already been committed to the cause, 3/4 pledged by European countries. An attempt, they say, to correct the mistakes of the past. When the COVID-19 vaccine was being distributed around the world, Africa was one of the last places where it was rolled out. Vaccine nationalism, where wealthier countries pushed to access and potentially hoard production, was blamed, creating not only deeper inequalities, but also allowing for further mutations in countries with lower vaccination rates. Despite the COVAX initiative that enabled low to middle income countries access to the vaccines.
COVAX helped us to reach the world's poorest and most vulnerable faster than we would have otherwise, but not fast enough. There is no doubt that the delays in reaching lower-income countries and communities with vaccines cost lives.
And it's not just COVID that's been deadly on the continent. Malaria kills more than 90,000 people a year. More than 6,000 have died in the current cholera outbreak across eastern and southern Africa, the largest death toll in years. 40% of those fatalities recorded among children under 5 years of age, exacerbated by flooding in regions where access to vaccines is most vital. The project aims to secure more than 800 million vaccine doses produced locally across Africa over the next decade. An achievement that would be some way to address the inequality that continues to overshadow healthcare around the world. Sonia Gallego, Al Jazeera.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.